Why should you do a needle biopsy for a parotid gland tumor? I'm Dr. Babak Larian from Centers for Advanced Parotid and Facial Nerve Surgery. I am a great believer in doing needle biopsies. And the reason for it is that needle biopsies can be very simple and relatively pain-free when it's done by an expert physician. As you see, the tip of the needle goes through the tumor, and in going through, it gets some cells inside the hollow bore of the needle. And then you spread that on a microscopic slide and let the pathologist look at it under the microscope. More than 70% of the time, when the needle goes through, it's able to capture enough cells for the pathologist to be able to tell you what it is. When there's enough cells, the accuracy of the information you get from that is about 95%. I found that 4% of times when they tell you that something is benign, there's a chance that it may not be benign. So there is that potential mistake, but I think your doctors can be very aware of that possibility, and during surgery make an assessment of the tumor. Does this look like a benign lesion, or is it behaving more aggressively? All right, so you can cover for that minimal percentage. And very good reason to do this is because there are 15 types of benign tumors, as you can see, that happen in the salivary glands, and 21 types of cancers, right? Now, in terms of the benign tumors, 14 of the 15 benign tumors never become anything more aggressive or cancerous, whereas pleomorphic adenoma, which is otherwise called a mixed tumor, has the potential of transforming into a cancer. And that's why we should remove pleomorphic adenomas whenever you find them. And the other ones, if you have a small tumor that's not really growing, you have an option of just observing the tumor and monitoring it to see if it's going to grow or if it's staying the same size. And if it's staying the same size, you have the option of not doing surgery and monitoring it. And that's a very important bit of information to know before you go into an operating room. There are many types of tumors that you potentially may not need surgery if they're not growing any longer, okay? So that's really one very important aspect of doing a needle biopsy, because it actually can save you from having a surgery. Very important. Now, in terms of the cancers, there's 21 different types of different levels of aggressiveness. Some that like to travel along the nerve, some that like to spread to the lymph nodes, others that like to spread to other parts of the body. So when you know that in advance, you can be aware of how aggressive you need to be with that cancer, if you need to remove the lymph nodes in the neck, if you need to look elsewhere in the body to make sure it hasn't spread. Before you go into surgery, you have an assessment of what type of tumor you're dealing with and how aggressive you need to be and what the extent of surgery is. The other important factor is that you can see if this tumor likes the nerves or not, and make a decision with the patient. What should you do with the facial nerve during surgery? Are you going to preserve it at all costs, or you'll do everything you want or you can to make sure the person has a better survival from this type of cancer? These are important bits of information for you to be able to make the right decision that's appropriate for you, okay? And so information is really power in this case. And most importantly, again, it can tell you when you don't need surgery, how extensive your surgery needs to be, how aggressive you need to be, and what your plans should be for the facial nerve. So I think it's very, very helpful to get a needle biopsy. Hopefully you find this helpful. If you do, please like us, please subscribe to us so we know how to make better videos to help you out. Be well.